Today's healthcare organizations are trying to navigate not only a transitioning technology landscape, but also a payment reform shifting from a fee-for-service to a new value-based payment model. Healthcare providers are continuously assessing how they can enhance patient care and grow revenue, while also improving cost, risk management, and outcomes. Many clinicians, policymakers, and health economists agree that improving healthcare quality, while controlling costs and risk, requires greater patient engagement. Improved patient engagement can result in better disease prevention by giving patients the tools to self-monitor and change behavior. Greater treatment success, based on increased compliance with lifestyle changes, therapy, and better clinical decision-making. As a result of more information sharing between the patient and clinician, Clovis AI provides the avenue for greater patient engagement and a world-class platform as unique as the patient. Whether they prefer their smartphone, tablet, laptop, or nothing but the router, Clovis allows the care team to provide automated messaging and reminders of upcoming daily activities, including medication adherence, physical fitness routines, wellness and education videos, doctor appointments, etc. This type of daily interaction enables the care team to virtually become part of the patient's life. Telemedicine is a part of an evolution of a more connected, patient-centered healthcare ecosystem. Clovis offers a user-friendly platform that not only analyzes real-time patient diagnostic data in order to identify trends or episodic events, but also offers unprecedented, automated patient engagement using the patient's Clovis router as the communication portal. Medical need is the next topic. As the ongoing management of serious, chronic diseases impact healthcare infrastructures, and consistent patient monitoring have become paramount in attempting to decrease the burden healthcare organizations are currently experiencing. 75% of hospitals are being fined by Medicare because of their high readmissions rate. According to Touchstone survey, virtual care will be one of the main deflators in an industry full of escalating healthcare costs projected to reach $3.207 trillion this year, roughly $10,000 per person, according to a report published by the National Health Council. Generally incurable and ongoing, chronic diseases affect approximately 133 million Americans, representing more than 40% of the total population of this country. By 2024, that number is projected to grow to an estimated 157 million, with 81 million having multiple conditions. About half of all adults have a chronic condition. More and more people are living with not just one chronic illness, such as diabetes, heart disease, or depression, but with 2 or more conditions. Almost a third of the population is now living with multiple chronic conditions. In 2020, 7 out of 10 deaths in the U.S. were due to chronic diseases. Heart disease, cancer, and stroke account for more than half of all deaths each year. According to the New England Journal of Medicine, people with chronic conditions receive only 56% of recommended preventive health care services. A 2018 study reported that 7 chronic diseases, cancer, diabetes, hypertension, stroke, heart disease, pulmonary conditions, and mental illness, have a total impact on the economy of $1.3 trillion annually. By the year 2023, this number is projected to increase to $4.2 trillion in treatment costs and lost economic output. A few years ago, in a first-of-its-kind move, Centers for Medicare and Medicaid Service, CMS, made remote patient monitoring, RPM, a separately reimbursable service under Medicare. Now, CMS has proposed 3 new codes for RPM services, retitled Chronic Care Remote Physiologic Monitoring, which do a far better job reflecting how providers can more effectively and efficiently use RPM technology to monitor and manage patient care needs, including chronic care management. Medicare already offers separate reimbursement for RPM. The service is defined as the collection and interpretation of physiologic data, example ECG, blood pressure, glucose monitoring, digitally stored and/or transmitted by the patient and/or caregiver to the physician or other qualified healthcare professional. Qualified by education, training, licensure/regulation, when applicable, requiring a minimum of 20 minutes of time. The new chronic care remote physiologic monitoring codes are CPT code 99457. Remote monitoring of physiologic parameters E.G, weight, blood pressure, pulse oximetry, respiratory flow rate, initial, setup and patient education on use of equipment. CPT code 99453. Remote monitoring of physiologic parameters, for example, weight, blood pressure, pulse oximetry, respiratory flow rate, initial, devices supply with daily recordings or programmed alerts transmission each 30 days. CPT code 99454. Remote physiologic monitoring treatment management services, 20 minutes or more of clinical staff/physician/other qualified healthcare professional time in a calendar month. Requiring interactive communication with the patient/caregiver during the month. Chronic care remote physiologic monitoring is not a telehealth service. Providers frustrated with the labyrinthine and narrow Medicare coverage of telehealth services can take comfort in the fact that RPM is not considered a Medicare telehealth service. Instead, like a physician interpretation of an electrocardiogram or radiological image that has been transmitted electronically. As such, Medicare pays for RPM services under the same conditions as in-person physician services with no additional requirements regarding permissible originating sites or use of the telehealth place of service, POS 02 code. This means chronic care remote physiologic monitoring does not require the use of interactive audio-video. Nor must the patient be located in a rural area or a qualified originating site. Patients can receive RPM services in their homes. Companies currently offering chronic care management (CCM) services should be particularly focused on expanding their business lines into RPM. Not only do CCM companies have current customers who can benefit from RPM services, the non-face-to-face technology and clinical integration requirements are fairly similar. Moreover, CCM and RPM can both be separately billed for the same patient in the same month, allowing additional revenue. According to the American Medical Association's AMA, the inclusion of the remote patient monitoring codes reflect how healthcare professionals can more effectively and efficiently use technology to connect with their patients at home and gather data for care management and coordination. While the interprofessional internet consultation codes have been added to reflect the increasing importance of using nonverbal communication technology to coordinate patient care between a consulting physician and a treating physician. A proven technology solution is urgently needed to alleviate the strain on the medical system and provide new monitoring options to patients with chronic diseases that will help mitigate the high rates of readmissions, resulting in lower costs overall and better patient care long-term.